Okay. Councilmember Cabrera, are you on? Good evening and welcome to Health Equity and Beyond, the Bronx Borough President Candidates Forum, sponsored by Bronx Community Health Network and City Limits. I'm Jarrett Murphy, the editor-at-large at City Limits. I'm one of your co-moderators tonight. This evening will feature a very timely conversation about an important office and critical matters of public policy and social justice. And now to talk more about why we are here is my co-moderator, the CEO of Bronx Community Health Network, Eleanor Larrier.
Thanks, Jarrett. Bronx Community Health Network is delighted to partner with City Limits. As Jarrett stated, I'm Eleanor Larrier, BCHN CEO. I'm pleased to add a warm welcome to our guests and to our social media audience. This is a great opportunity for us and for you to hear how the candidates plan to address some of the important social and economic issues that prevent many Bronx residents from achieving maximum health and well-being. BCHN is a nonprofit community-based organization and federally qualified health center. For the past 24 years, we have partnered with two major Bronx healthcare facilities to ensure access to affordable quality healthcare at 21 network community health centers. In 2020, these centers cared for nearly 96,000 patients, a significant drop from the previous years due to the pandemic. A disproportionate number of our multicultural, multi-ethnic Bronx population has difficulties accessing healthy food, stable housing, jobs, and other needs, commonly referred to as social determinants of health. Like many of us, these needs are often more pressing than taking care of our health. Add to this the complexity of social and healthcare systems. COVID-19 served to make health disparities and inequities in healthcare delivery systems painfully clear. During the pandemic, BCHN launched a food delivery initiative to provide groceries for families. You might have seen our big green van in your neighborhood. Our staff kept in touch and connected our clients to resources by telephone and by video, and volunteered at partner health centers to navigate patients through the vaccination process. At BCHN, we understand the challenges facing Bronx residents and are committed to empowering individuals and families to make and maintain healthy life choices.
Thank you, Eleanor. And now on to our event. The Bronx Borough President, just in the way of background, serves a constituency larger than all but 9 US cities. The BP plays an important advisory role in land use decisions, helps guide the delivery of city services, appoints members of community boards and key city commissions, and directs millions of dollars in capital spending. She or he can also serve as a spokesperson or ambassador for the borough. The BP is elected to 4-year terms. It can serve up to 2 such full terms. The current borough president, Ruben Diaz Jr., is leaving office because of term limits. The next BP will be elected in the November general election, but the Democratic nominee will be selected next month via a June 22nd primary election with early voting beginning on June 12th. All registered Democrats living in the Bronx can vote in that primary. 4 of the 5 people on the ballot in that primary are with us here tonight. In alphabetical order, they are Councilmember Fernando Cabrera, Assemblymember Natalia Fernandez, Councilmember Vanessa Gibson, and State Senator Luis Sepulveda. The 5th candidate, retired Police Lieutenant Samuel Orvello, withdrew earlier this afternoon, citing a conflict. The format for tonight: there will be no opening statements. Each question will be directed to a particular candidate who will have 90 seconds to answer, after which the other candidates will have 30 seconds to respond. Answers and responses will rotate alphabetically. Moderators will allow rebuttals and ask follow-ups as warranted. And now with the first question for Mr. Cabrera, here's Eleanor.
Okay, thank you, Jarrett. And we're off and running. Councilmember Cabrera, as a Bronx Borough President, how would you use your discretionary funds to support health and health equity to move towards achieving healthier living and better health outcomes for all Bronx residents? Please be specific.
Thank you so much, Eleanor, and thank you for having us here today. The Bronx Borough President actually does not have discretionary funding, with the exception of senior discretionary funding. And this last year, that funding was eliminated, and we're looking forward to restore it this year. For obvious reasons, we eliminated it last year. But if you're referring to that discretionary funding, then we're talking about, I think somebody's in the line.
I'm sorry. Could everybody who's not a candidate please mute themselves? We are getting a little interference. I apologize, council member.
Thank you. No problem. So if you're referring to the discretionary funding from the discretionary funding for the seniors, so we're looking forward to working in partnership with hospitals, health centers, mental health centers, such as Morris Hive Sales Center that I have here in my district. We also have capital, and capital is very, very important. I have worked with the Union Hospital and other hospitals where I have provided capital funding, looking forward to listening to the needs that the hospitals have. They're the ones who understand in our health centers. They're the ones who understand and they have the ear on the ground in terms of the type of funding that they're gonna need. But I'm looking forward to continue the legacy that I have put forth in making sure that they get the tools that they need in order for our people to get the health treatment and the health equity that they truly deserve.
Thank you. Assembly Member Fernandez, your response.
Thank you. Well, with the capital money that we do have, I want to look into fulfilling the needs of our local hospitals. Many of them have still pending requests for new X-ray machines, new MRI machines, things like that. But going deeper into our community, we need to look at utilizing this money for our community doctors, those that are right in our neighborhoods, that may be in our apartment buildings. They have not been properly aided to upkeep with the evolving technology. So if we can find out how to use that money to help our local doctors in our neighborhoods and also expanding into our NYCHAs, that's something I'm looking to do.
Thank you very much. Councilmember Gibson.
Thank you so much. Good evening, everyone. Thank you to BCHN and City Limits for hosting us today. Always appreciate the opportunity to talk about the importance of the Bronx Borough President's Office. As the Borough President's Office has a significant amount of capital discretionary dollars, we want to invest in our infrastructure. We want to expand on school-based health centers that need to be in every single school. Every school should be a community school, and it should be equipped with full-time social workers, guidance counselors, and nurses. And we also want to invest in our community-based health centers, many of whom we've been working with over the years. We know that you have a lot of capital needs and a lot of capital asks, and we want to honor that and make sure that we invest. And as it was mentioned, hospitals working with, whether it's St. Barnabas or Bronx Care or H&H, all of these hospitals have a lot of need to continue to fulfill their duty to provide sufficient health care. So as Borough President, we would make sure that we work and honor those requests as best as possible.
Thank you very much. And Senator, your response. Sir, you're muted.
Thank you. Good afternoon to everyone. Eleanor, thank you for hosting the program. We talk a lot about programs. We mention all kinds of programs that we have in the community, and what they're doing, I believe, are more band-aids. One of the issues that we have to tackle in this county is we have to eradicate poverty, because the social determinants that talk about us being at the bottom of health determinants is because of the level of poverty that we have here. And so we have to have an economic development plan that's going to get people jobs and get better housing, get better food. We can talk all kinds of programs, but if we don't eradicate poverty, we're only going to make a slight dent. There are some programs that I think can be effective. First of all, we have to spend more money messaging people about healthcare information. We don't have enough money to message. We have to increase screenings, because that way we can determine who can go to ERs, which we don't want, and who can use other services so that we can prevent ERs, which are more expensive. But a transformative program, I think, that can change the Bronx and make a bigger dent in a faster period, which would be something called value-based payment, where doctors are rewarded based on providing good health to people who live in the community. The better the patient is, the better the health of the patient, and not just physical health, but mental health, then the doctors will be rewarded accordingly. I think that will attract some of the best doctors who have a social agenda in mind to come into the Bronx, to come into our communities and provide the best healthcare for the people that live here.
Thank you so much, Senator. Eleanor, do you want to proceed with the follow-up?
There are several communities in the Bronx that have inadequate access to affordable, quality primary health care. What do you see as the BP's role in increasing development of primary healthcare facilities like community health centers? Would you consider using your authority as BP to encourage land use applications for healthcare facilities? Where do you see some of the greatest need and for which types of health providers?
Thank you. And
You have
sorry,
90
Ms.
seconds to respond. And that is Assemblymember Fernandez. You go first.
Thank you. Well, as we talk about the Bronx and the deserts that exist here, transportation deserts, food deserts, we do have some health deserts. And there are communities that don't have local community-based organizations that are at far distance, or it takes a long time through public transportation to get to hospitals. So we need to really look at getting deep into our communities and bringing those services there. I would look at the city services to make sure that we have HHC facilities more into our communities, expanding community-based health centers in our schools, in all schools, as it was said, but also in our senior centers, and making our public spaces a place of education, of resource, and making sure that people know where they can get all types of health, for mental health needs, physical health needs, and for our youth and our seniors.
Thank you. Next. Councilmember Gibson, same question goes to you, and you have 30 seconds to reply.
Thank you so much. I definitely think we have to look at the economic development opportunities with any land use ULURP application where you have housing. We have to look at ground level retail commercial space. That also could mean Article 28s and FQHCs and more of our community-based health centers. We've been able to work very closely with many of our providers. We have a new one coming into Highbridge by Damien Healthcare Center. We've been working very closely with Morris Heights and Urban Health and Union Community Health Center and many others. And I think we have to offer them the opportunities to expand. And now that we are continuously dealing with COVID, we also have to expand on telehealth and make sure that we do health and mental health wellness checks on many of our elderly and medical frail residents and clients as well.
Thank you. Senator Sepulveda, 30 seconds to respond.
Thank you. Absolutely. Community health care centers are the backbone and the heart and soul of our community system here in communities with poverty and communities of color. And so I would do everything possible to increase the number of Article 28 centers that service this community. It's a vital necessity. They have the pulse of the people that live here. One thing I'd also push for, use my bully pulpit, is to pass the New York Health Act. I believe the New York Health Act, which will provide universal health care to us, which is the poorest county, and probably one of the poorest in the United States, not probably, but it is the poorest in New York State. It will probably clean up a lot of the mess that we have with our healthcare system, our health insurance. So I would be out there with my colleagues in government pushing to pass Senator Gustavo Rivera's Health Care Act, because I think that could be a big savior for people in this community.
Thank you so much. Councilmember Cabrera, the same question goes to you. And again, 30 seconds to respond.
Thank you, Eleanor. The fact is, I've been working with health centers such as Morris Heights Health Center, which is actually in my district, and they are expanding, and I provided millions of dollars in capital funding to making sure that they could do the expansion and do it well. They actually have expanded even into housing. And so they have a comprehensive approach. And right now, they're coming with some very innovative way of reaching our community, where they will have something that emulates mentorship and follow-up. And I think this is the critical part, where we can have all the wraparound services and be able to provide proper follow-up for all of our patients in our district.
Thank you so much for your responses.
And now this next question will go first to Councilmember Gibson with a 90-second response. Disparities that may be attributed to systemic racism abound in healthcare and social service delivery systems. These disparities may be due to misperceptions about the lives that Black and Brown people lead. Whatever their origin, they have real life and real death consequences. How do you think the borough president can influence racial equity in service delivery systems in the Bronx as it relates to healthcare? Ms. Gibson.
That's a great question. The borough president's office has the ability to influence a lot of policy decisions as well as budget decisions. We should all strive to achieve healthcare justice. Too many of our African-American and Latino women are more likely to die during childbirth because of disparate healthcare. We have to focus on maternal healthcare, maternal morbidity, and dealing with infant mortality. And I think we also have to make sure that every family has access to affordable and low-cost healthcare. Many of our families rely on Medicaid and Medicare, and we have to make sure that there is no discrimination in the system. So we have to work with the hospital providers and all of our stakeholders, whether it's through the legislative process, making sure that there are no disparities based on your color, your origin, or your form of payment. It's happened far too often. You have so much discrimination happening across the system, and it's unacceptable. As co-chair of the Women's Caucus in the City Council, we've been pushing the issue, talking to providers about more doulas and midwives, because we don't have a lot in the Bronx. And too many women have died during childbirth, and it's unacceptable, Black and brown women. And we have to change that. We have to provide all birthing individuals with the same rights as everyone else. And as borough president, I will make sure that we provide a comprehensive plan and a blueprint, and we will work with all of our colleagues in the City Council, the new administration, as well as all of our healthcare providers to make sure that we remove all of those barriers that would prevent anyone from accessing quality healthcare.
Thank you very much. Senator Sepulveda, you have 30 seconds to respond. Oh, nope, still, you're still muted, sir.
Sorry about that. Yes. So again, I don't mean to repeat myself, but a lot of the issues that we have with healthcare, discriminatory or otherwise, has to do with the level of poverty that we have. If we can cure poverty, we'll cure a lot of these programs. But I think that my program, what I want to push, which is not anything that I've created, but organizations like Somos have talked about it, and that is the value-based payment. If you have value-based payment, if you have a knucklehead doctor or healthcare provider that's racist, he now has an incentive to provide the best care to the person that he's servicing. So, we have ways of filtering people that we know are going to engage in discriminatory behavior and policies, and organizations that are, or healthcare providers. But if you give people an incentive to provide the best healthcare, I think that's one of the best ways and fastest ways where we can cure this problem with discriminatory policies in our healthcare system.
Thank you, sir. Councilmember Cabrera, 30 seconds.
Thank you so much. Look, success happens when we have access, and not just access, but results that are equitable. What's happening here in the Bronx is that that has to happen at the highest level. I'm talking about from staffing at the leadership level. So our health centers and hospital look like the people in our community. That requires for us to have a health justice center like they have at Columbia Presbyterian Hospital in a hospital, so we could look at the data and see where are these gaps that are taking place. I'm very data driven. I want to know the facts before because assumption is the lowest form of knowledge. I want to make sure that if we are going to tackle these problems, specific problems, we got to have the right data. And I'll be calling for health justice centers in our Bronx hospital, especially our H&H hospitals.
Thank you so much. Assembly member, your turn, 30 seconds.
Thank you. We need our healthcare providers, our doctors to look like us and come from our communities. We are a very diverse borough. We need diversity in medicine. I've been a strong supporter of the Diversity Medicine Scholarship to help Black and brown young people get the education so they can be the doctors in our community. Those that understand our cultural backgrounds, those that understand past eating habits. These are things that will help Bronxites educate themselves to be healthier, to act healthier, and to feel comfortable in their healthcare facility, knowing that this doctor understands them, understands their history, their ethnicity, and can properly address those needs. But also to expand services like birthing centers. We don't have one in the Bronx, and it's really deplorable that we don't, and we're allowing lack of services to remain here. We need to make sure that we're funding these institutions, creating them if they don't exist, and keeping them in our communities.
Thank you so much. Eleanor, your turn.
Councilmember Gibson, I think this is the last FQHC specific question. FQHCs serve everyone regardless of their ability to pay or immigrant status. How would you strengthen their role and visibility for Bronx residents who are most in need of their services? You have 90 seconds to respond.
I would continue to support all of our community-based health centers applications for Article 28, which I've done since I've been in the city council, in making sure that not only are they approved as an Article 28, but they have the support and the services and the resources on the ground. I would make sure that we recognize a geographical diversity. So we have all neighborhoods that really need healthcare centers to be able to get that. As we look at new construction, as I mentioned, we have an opportunity to have FQHCs at the ground level, and they will serve the needs of all of the residents in that building. Supportive housing projects as well. We can work with those CBOs and make sure that we can have supportive services coupled with healthcare centers and clinics on the ground as well. I would work with the community boards and many of our stakeholders and healthcare advocates that work on this every single day and fight to deal with the disparities that we face every single day. The Not 62 campaign, recognizing 5 years of this journey. All of the partners that we've been able to work with, as well as many of the community providers that formulated the Jerome Avenue Revitalization Collaborative, JARC, for short, as well as the Jerome Avenue Public Health Task Force that Councilmember Cabrera and I started back in 2018. We want to make sure that all of those recommendations are followed through, but we have to make sure we have access, opportunity, education, and recruitment and outreach. Thanks.
Okay, thank you. Okay. Senator Sepulveda, you have 30 seconds to respond. Mute.
Sorry about that. Obviously, I've said it again, and I'll say it again, that these are the FQHCs are the backbone, the Article 28s, the community-based centers are the backbone of good health or better health in our community. So as the borough president, of course, you use the bully pulpit to make sure that you create an environment where you can get funding, because you have to work with the governor's office, you have to work with the mayor's office, you have to work with the city council to make sure that you get funding and target those areas where you have the largest health disparities in the entire city of New York, most of them here in the Bronx. So you use that bully pulpit to get funding, to put in programs throughout the county, throughout the district that you know are going to impact a greater number of people that have the greatest number of healthcare metrics that are the poorest in the county.
Okay, thank you. Councilmember Cabrera, the same question for you, and 30 seconds.
Thank you, Eleanor. Look, I will use all the political force available to me, and also networking with my colleagues. They are truly the ground, the foundation, and the safety net for healthcare in our community. I've seen it firsthand in my community. And so as the next borough president, I will provide that leadership, that influence that is required to get them to the finish line. And, you know, things change like we saw in the pandemic. They need to be well equipped, funded in order for them to be able to complete their mission.
Mute, unmute game. Assemblymember Fernandez, the same question goes to you, and 30 seconds.
Thank you. Well, much like all of us are doing now, we will have a campaign, a healthcare campaign. Working with our community-based organizations, our healthcare leaders, our community leaders, faith-based leaders, to help push the education and the resources that are here, to make sure that we're focusing on the areas of need and advocate strongly for them. We have this stage, the soapbox, the bully pulpit. We will be loud, we will be proud, we will be determined to make sure that our communities are serviced and that our needs are seen and that they are met, and that working with our elected officials in the governor's office, the mayor's office, and our council members, and everyone involved, whatever powers that be, we will use them, we will push to use them, and we will make sure that we get the results we need.
Thank you so much. Thank you for your responses.
Yeah, thank you all very much. And thank you for the attention you're paying to our intrepid timekeeper, for keeping your answers nice and concise. I'd also say that I think the candidates, because you're all very important people, it's okay if you leave your mics unmuted. We assume that you're not saying anything terrible about your rivals between answers, and that will make things a little smoother. So keep yourselves unmuted if you can. This next question will go to Senator Sepulveda first for a 90-second response. COVID-19 laid bare inequities in technology across the city, including the ability to participate in telehealth. Many Bronx families often had no access to a computer. Many may do with a small tablet or shared a smartphone. This poses tremendous health privacy challenges and results in delayed treatment. What would you do as next borough president to make technology more accessible, not just for telehealth, but for all aspects of life? Senator?
Thank you. Thank you for the great question. I haven't waited to becoming the next borough president, but we started working on that through the state budget, where we allocated monies to increase telehealth into poor communities. We also have legislation that requires the poor families get internet service for $15, broadband for $15 a month. So that's one of the components that we have to get in order so that people that are in poor communities can get access to telehealth. As the borough president, again, whatever funding arm I can use, I know that primarily we have discretionary monies for capital, but we can be creative. We can work with our local elected officials, our local city council people, again, with the governor, with the mayor, to see where we can allocate more funding into this county, the poorest county, so that we can get greater access to telehealth. But we also need translation services. We need language access is a very critical component of any telehealth services that you're going to provide. I can tell you that while I was out there helping people during the pandemic, while I was out there delivering thousands of pounds of food, thousands of face masks, when I went to the homes of people, one of the issues that they had, that they wanted to provide telehealth, couldn't get it because they didn't have internet. And so that's one of the critical components, that we bring the technology to poor communities so that people can get the same services that more affluent neighborhoods get.
Thank you so much. Councilmember Cabrera, 30 seconds.
Thank you so much. Look, in the Bronx, we still have gaps. I sounded the alarm back in May, featuring daily news, how many of our children didn't have the tools that they needed. They didn't have laptops, they didn't have iPads to be able to study. And then we saw also the broadband gap as well. And you know, when you see what happened in the pandemic, it highlighted the gap, the health gap, the broadband gap. I'm looking forward to taking telehealth to another level where it's better, more accessible, because there are issues such as post-operation wounds and other types of conditions that our people are experiencing, that is better for them to do through telehealth. And so I'm very committed to pushing the envelope in the needle in the right direction.
Sir. Thank you very much. Assemblymember Fernandez, 30 seconds.
The pandemic showed that the digital divide is very real and is very wide. Many of us have been that service to our communities to help get them laptops, to being the triage agent to our schools to get our students the things that they needed. But telehealth was seen to be something absolutely needed for us, especially our senior population. So giving whatever funding, fighting for funding with our partners to make sure that we can provide that option to some individuals. We need to make sure that our public spaces, our homeless shelters, NYCHAs, senior centers, libraries, even public buildings are providing free Wi-Fi. I'm very proud too to say that I fought in the state budget to make sure that we got the low cost internet for low income families, but we need to make sure it goes wider and deeper.
Thank you very much. And Councilmember Gibson, 30 seconds.
Thank you. I agree. We have to do everything possible to expand Wi-Fi and broadband access. I've been very proud of the council to continuously fund capital projects for technology upgrades for laptops, Chrome notebooks, and smart boards, because we know that so many of our schools are in need and so many students and families live in temporary housing. I think we have to look at some of the public-private partnerships that we can also embark on and work with many of our CBOs and many of our senior center providers as it relates to telehealth and home visits, because many families are living in social isolation and they don't believe that anyone is helping them. We have to be creative and innovative in our approach to reach people where they are, to provide the cultural sensitivity, language access, and diversity that is needed, and the continuity of care that so many families deserve.
Thank you very much for your answers. Eleanor, you're up.
This question should be familiar to our state representatives and hopefully to others. And this question goes to Senator Sepulveda first, 90 seconds. The federal 340B program provides discounted medications for patients at safety net providers like our FQHCs. Large pharmaceutical companies are demanding an end to the discounts. In some cases, they've stopped providing needed chronic disease medications to 340B pharmacies. New York State Department of Health has proposed a Medicaid carve-out of pharmacy benefits. Patients who rely on affordable medications and community health centers that serve them are the ones most affected. Safety net providers will lose an estimated $250 million because of this. How can the borough president work with New York State legislators during this delay in the Medicaid pharmacy carve-out to ensure that it is repealed and Bronx residents are not deprived of jobs and essential services and medicines?
I'm sorry, great question, Eleanor. And one thing that doesn't go unnoticed about that question is your ability to work with other elected officials in the county to make sure that we get the repeal and provide the healthcare. Look, first of all, I think the issue that we're talking about would be resolved with the New York Health Act. But I have demonstrated the ability to work with other elected officials because I passed some of the most progressive legislation that the state has had in the last 25 to 50 years with the Green Light Bill and the DREAM Act. So in order for you to impact this discussion, you have to be able to work with other elected officials. And that's what I've demonstrated the ability to do. So you have to have a relationship with the stakeholders. You have to be able to work with them to make sure that this practice is discontinued so that the people in this county don't suffer the most. The poorest people are able to get affordable medication and healthcare, no matter what happens in the state of New York.
Councilmember Cabrera, the same question goes to you, 30 seconds.
I agree with the senator. I also passed over 40 pieces of legislation in the New York City Council. As you know, that's not an easy goal to achieve. So that level and networking is required to get anything to the finish line. What I would say is this: number one, we need to use the umbrella of the CARE program that we have in the city of New York that could serve as an umbrella, is a catchment to provide services. But right now in the Bronx, only 10,000 are availing themselves of that. In the meantime, for the meantime, and then be able to indeed work with those who could to get it right. We need to get this right because people are hurting, especially right now. This is like the worst time for us to have this hole in the system, a system that is broken.
Thank you. Assemblymember Fernandez, you're up, and 30 seconds.
Thank you. Well, the office of the borough president is a position of power through influence. And I see this also as a role to advocate loudly, to advocate diligently, effectively. I too work great with my partners in government. And while I will work diligently with my Bronx delegation here, this is something that we will need more support on. So I will cross county lines. I will go to Brooklyn, Staten Island, Manhattan, speak to all the members there to really understand the needs of the borough, because we are a borough that has suffered more. We are a borough that has not made it to certain levels that other boroughs have. And they will hear from me. They will see me knocking on their door. They will see me up in Albany if it has to be. But the advocacy needs to be strong.
Thank you. Councilmember Gibson,
Thank you.
30 seconds.
Our safety net providers need to be given all of the assistance and access to resources as much as possible. There should never be areas where people are discriminated against based on their health conditions and their form of insurance. Many of us have loved ones and constituents that live with underlying health conditions, have been affected by COVID-19, have been traumatized and in need of mental health and mental wellness. And we need to make sure that we remove every obstacle that would prevent anyone from accessing quality and affordable healthcare. And that includes medication. So as borough president, I would assemble the delegation, healthcare advocates, patients, our hospital providers, nurses, healthcare heroes and sheroes, and everyone in the industry that cares about diversity, that cares about eradicating disparities and breaking down these silos that don't achieve the healthcare justice that every Bronxite rightfully deserves. And we will pass legislation, we will advocate, and I also want to make sure that we get money in the budget. So if we need to repeal laws, then that's what we need to do, and we will make sure that we get it done with all of our stakeholders.
Okay, thank you. Thank you for your responses. Jared, over to you.
Thank you, Eleanor. COVID-19 exposed steep disparities in food security in the Bronx as well. What would you do as borough president to promote and maintain funding for community gardens and urban farming and other government programs that facilitate access to fresh fruits and vegetables that are essential to a healthy diet? I'll start with Mr. Cabrera. You have 90 seconds.
Thank you so much. This is one of those topics that I love, and there's two vegans in here. I'll let the other vegan introduce himself as a vegan, because I've seen it with my own life, the health benefits. And look, I think that we need to introduce more advanced cooking education programs through our healthcare providers. I know Montefiore Hospital has one of those. I like to see more education starting the 8th grade program. Columbia Presbyterian, I hate to mention them again, but they also have a program for 8th graders in the school. I like to see more leadership from healthcare providers to provide that level of education. And I like to see more farmers market all across the Bronx year-round. Farmers market, and also within the schools, so the kids could farm. I have that in my schools. I provided for hydroponic farms, indoor farms, and also for outdoor, provided funding for that as well. So the kids could see the fruit of their labors, be able to enjoy, see the value of eating well. And that's how we're gonna turn the needle. Look, medicine is not the preventive answer. The preventive answer is for us to eat well. That's how we are going to change the needle when it comes to the health disparity that we have at the end of the day.
Thank you very much, sir. Assemblymember Fernandez, you're up for 30 seconds.
Yes, food insecurity is a big problem here. We've done what we can, I know all of us here, to provide the needed resources to our communities. But we have to eliminate food deserts. I get told all the time, Hunts Point Market has all this food. How do we get into our communities? Well, we need to bring the food suppliers to our communities. More supermarkets, more farmers markets that accept EBT. Urban farming, cooking in school, these are all great ideas too. And we should expand that more so, not just in our schools, but to our community groups. We have a lot of park associations that do a lot of the maintenance themselves, but have gone into community gardens. We should be able to help them grow for the community, by the community, to help keep the community healthy with healthy options.
Thank you. Councilmember Gibson, 30 seconds.
One of my favorite topics, food insecurity has been heightened and exacerbated by COVID. I agree, farmers markets, green markets should be all year round. I want to expand the Health Bucks program, which are the $2 coupons that many of us fund in the city council. I want to make sure that we focus on initiatives like healthy bodega initiatives, working with supermarkets and our bodegas. I believe we should develop food councils and work with many of our school providers and health educators and make sure that we have scratch kitchens in our schools. Excited about that. Working with groups like Hunger Free America, providing food nutrition classes. Worker co-ops is a way that we can grow our own fruits and vegetables, and expanding on community gardens and green thumbs, and making sure that we provide universal, healthy food for every Bronx resident and family.
Thank you very much. Senator Sepulveda, you're up for 30 seconds. Oh, sorry. Unmute yourself.
I guess I'm the bad boy today. I'm sorry.
It must be a vegan thing.
Yeah, I'm the other vegan on the program. Look, when the pandemic hit, to date now, I've given out over 60,000 pounds of food for people in our community. And I just established a program where I'm going to almost on a weekly basis be able to give out anywhere between 10 and 20 pallets of food every single week. So the borough president has to be able to do efforts like that. I've worked with private partnerships to bring this program here. So if anybody needs food, they can come to us. But look, we have the botanical gardens. We have an incredible garden that's internationally known that we can use that as a fulcrum to teach our kids about vegetation, about good health. We are, the healthcare industry is the largest provider of jobs in this county. And so we should have a program with healthcare providers. We should have a program with our public schools. And something that I've been thinking and working that I want to bring to the Bronx is a collaborative effort with upstate farmers. I know many representatives from the other party who represent farms, and we've been talking about doing a collaborative effort where we can bring kids to the farms, work on a program, a discounted program to bring vegetables and fruit from farms of state into the Bronx. You have to be creative. You have to be revolutionary. You have to think long-term. And that's exactly what we're doing in my campaign.
Thank you so much. Eleanor, your question.
Okay, thank you. Councilmember Fernandez. I'm sorry, Assemblymember Fernandez. What are your plans to address increased mental health stress and substance abuse since the pandemic? You have 90 seconds to respond.
The mental health stress, the trauma that we've all experienced, especially our seniors who've been isolated and our children who've had to see a lot of their family members go through the struggles. We need to bring that support. Telehealth can help be that connection for many seniors to talk to therapists, to connect to them, to connect with family. For our young children, we need to have our schools be more supportive for mental health needs. Social workers, psychologists, counselors, they need to be in every building. Every school needs to have a school nurse to help identify some of the ailments that many students are seeing, and even teachers, administrators. I have a bill in the assembly to provide that training for administrators, teachers, all individuals in the school to see signs of mental stress. But more so, we need to help fund, again, the community-based organizations that do these practices, that have that connection to our communities, that can be that friendly branch to bring them in and to allow them to speak their mind, get the services they need, and get the help that they need. But also the borough president's office needs to be an advocate as well for those that have been suffering in silence, for those that have been locked up at home, continue to be victims of domestic violence, because we know that the numbers have went down, the reported numbers went down because those that were quarantining were with their abusers. So we need to be that resource, that arm, that real friend to our community, to let them know that there is help out there, and to provide the help to those that can give the help to those that are suffering and those that need an outlet. And for substance abuse, we must look into looking at, I'm sorry, what was it called? Safe injection sites. It's been a hot topic conversation, one that, is concerning to many, but at this point, what is working? We need to take some drastic steps to really help those that are suffering, that need the rehabilitation and that need the guidance to get there.
Okay, thank you so much. Councilmember Gibson, your turn and 30 seconds.
Definitely. Well, I'm glad that in the executive budget proposed by the mayor, there is a new creation of a mayor's office of community mental health, where we will train thousands of workers on first aid mental health, and really rebranding the Thrive NYC program that no one believed was very functional and successful, and really looking at more mental health support, working with our medical professionals and CBOs, our school-based health centers, and many of our educators. I think we have to really be creative because there are many people that are living with an undiagnosis. They don't have an actual diagnosis, but they're living with a mental illness and they need help as well. We need to also look at trauma-informed care, working with our family justice centers and DV clients and making sure that we take care of their needs, as well as our senior centers and older adults and those that are medically frail and homebound. We need to work with a lot of our HDFCs that operate these buildings with seniors and get in there and make sure that we're checking in on seniors. That's the problem we found during COVID. A lot of seniors and others that live by themselves, no one was checking up on them and they were living in isolation, no food and no services, and many of them did not survive. So we have to do something different. And I hope that this new office will be coupled with resources and tangible ways that we can address the mental health needs of all New Yorkers and certainly all Bronxites.
Thank you. Senator Sepulveda, you have 30 seconds to respond.
Thank you. The issue of mental health has been something personal to me. My mother suffered from mental illness, and when I was 11 years old, she committed suicide. So I am fully personally aware of what happens when you don't diagnose and take care of somebody with the right level of care and they suffer from mental illness. You know, between 11 and 19-year-old Latina women, the biggest killer is suicide. That's coupled with mental illness, of course. And even African-American children as young as 8 years old have a high rate of suicide for kids that age. To me, it's about providing all the resources and looking to the programs, the creative programs that have worked. There are a lot of programs. Thrive New York didn't reach its goal, but that doesn't mean we throw the baby away with the bathwater. We can modify it. We can couple it with other programs that we've seen levels of success. And so whatever it is, we have to do it. We also need translation services and information. We have to get information out there because people don't know about these services. People deal with this stigma in their families. People are almost ashamed to talk about mental illness in their families. So we as leaders, we as people that can provide information, we have to provide this to the community at large in many languages so people know that to have mental illness is something to be ashamed of, but instead something to take care of so that you can have a better and brighter future. Thank you.
Thank you. Councilmember Cabrera, the same question goes to you. 30 seconds.
Thank you so much. I'm the only candidate that is a licensed mental health counselor. I'm a doctorate in counseling and worked as a school counselor and certified school counselor. Look, I could tell you this, we have a shortage of mental health counselors right here in the Bronx. The HPSA average in the nation is 15.8. Here in the Bronx is almost 20. And when you get at that level, it's telling you you have an extreme level shortage in the Bronx for a mental health counselor. We need treatment on demand. Somebody wants to get off of drugs, they can get treatment right away. They don't have to wait and put in some kind of waiting list. Continue doing the Cure Violence program that we're doing here in the city that I got started alongside with Councilmember Germani Williams. Community schools, as it was mentioned by my colleague, Vanessa Gibson, to have those wraparound services right there in school, because often those symptoms are manifested right there in our public schools.
Thank you all so much. Jared?
Thank you very much, Eleanor. And this question will go first to Councilmember Gibson. The Bronx has a substantial senior population that is expected to grow significantly in coming years. What things do those older New Yorkers need to have healthy older years? And what can the borough president, the next borough president, do to help them achieve that? 90 seconds.
Well, I sure wish the office of the Bronx Borough President had access to discretionary money, because I would say what I've been doing now is is providing services for health and wellness and fitness classes and trips to botanical gardens and the Bronx Zoo and cultural trips, and really making sure that seniors have a fruitful life. If they're a member of a senior center, they have a wealth of programs and services. I know many of our older residents love bingo, and so we want to make sure that they have opportunities so that they can live a fruitful life. I am a big supporter of NORCs. I think we need to expand on many of our naturally occurring retirement centers in addition to senior centers. But I also think we have to do a lot more recruitment. Not every older resident is a part of a senior center or a member. So I also think we need to look at many of our senior standalone buildings that are NYCHA and some of the other Mitchell-Lama and rent stabilized buildings. And we need to work with those property owners and management companies and implement the idea of having a senior center or a health and wellness center so that seniors could have access to social services, mental health care, therapeutic services, wraparound services. We can partner with CUNY and the various schools of nursing so that we can get social workers that will provide a lot of care, those that may live with Alzheimer's and other mental illnesses. We can address a lot of those issues. I think the bottom line for us is to take care of our seniors as they have taken care of us. They did the work, they laid the groundwork for all of us to be where we are. And in their later part in life, no matter how long God keeps them here, we have to do everything possible to allow them to enjoy life in the most fruitful way.
Thank you very much. Senator Sepulveda, 30 seconds.
One of the great places to go in our community and go visit is our senior centers. That is essentially the heart and soul of what we do as elected officials when we go visit them and talk to people. The senior centers can serve in so many different capacities. We were just talking about telehealth, right? There's an area where you can provide broadband services so that they can get the kind of health information that they need. The seniors have to have Article 29's community-based health centers locally and close by within at least a 15-minute radius so that they don't have to go far away to get the kind of services that they need. We have a lot of beautiful things that we can do with our seniors here. You know, we have the botanical gardens, we have the Bronx Zoo, we have Orchard Beach, so many different diversions that we can provide to our seniors. But in terms of health, let's provide them with telemedicine. Let's provide them with language access in telemedicine. Let's provide hotlines and mentorship programs so that community people that want to help seniors, that want to work with seniors, professionals or otherwise, can have sort of like a buddy system so that they can talk to people that may be feeling a little down or need a little assistance. But let's fund the community centers. And that's where I would push as much as possible to fund our community centers that do a great job. They do great work already.
Thank you, Senator.
The means to be able to do even a better job for our seniors.
Thank you very much. Councilmember Cabrera, 30 seconds.
I'm glad the senator talked about funding a senior center. I've been doing that. As a matter of fact, I provided funding for technology training for our seniors and our senior centers. I even provided funding to build a gym inside of one of our senior center. I was able to have automatic enrollment in SCREE program, pass a bill to make that possible whenever our seniors visit or apply through any other city application. My very first budget action was to save 3 senior centers during the Bloomberg year. They were slated to close. They were even had their boxes already wrapped up, and we were able to save them. They're still all functioning today. The population increased by 20% in the last 10 years, senior population in the last 10 years, the most out of any county. The baby boomers continue to grow in our borough. I want to make sure that they have all the funding, all the senior centers continue to have the funding like I have done in the past.
Thank you so much. And Assembly Member, you have 30 seconds to respond.
Thank you. Yes, we got to keep the entertainment, the fun, the good things going. Funding our senior centers so they can provide some of those services, trips around the borough, shopping trips, maybe outside the borough. Those are things that they can do. But working with other private partnerships, creating that partnerships, we can get sponsored events where we can have festivals, events happening in the borough that they can enjoy. But one thing that the borough president's office can do, land use, we mentioned it, is more senior housing. That is a big request that I've gotten in my area. I need senior housing, and there's waiting lists that are up to 10 years long. So that's something we need to look towards, to making sure that we're providing seniors with a safe home, with the proper protections and great things to do, because this is the Boogie Down Bronx. We could do a lot here.
Well said. I just want to ask a quick follow-up, because a few times it's come up, the fact that the borough president does not control any discretionary funds. I think Councilmember Gibson just mentioned that again. Is there any workaround to that? I know that past borough president Fernando Ferrer, he got all the council members to kind of pool their discretionary funds to achieve some things. Of course, that was in a bygone era. Is there any way to get that into the budget, or to try to work around that? Start with you, Councilmember Gibson. Do you think there's a way to achieve some discretionary power for the borough president?
I think it's possible. We would have to work with the new administration because as it stands right now, Councilmember Cabrera mentioned it, but each borough president gets a capital allocation based on population. And so there are times when that number does fluctuate, where the initial number is later changed, it's higher, it's less. And there has been money for senior services designated for each of the borough presidents. But over time, I think that money has diminished. And I think it's important that as we look to the future, it will be great if we could be the advocates to make sure that there is an actual line item for the borough president for discretionary money that would, again, be flexible. So it could be a youth pot, it could be seniors, it could be program money.
That makes sense.
Definitely. Mm-hmm.
Does anybody else want to weigh in on that, or shall we move on?
No, I mean, we don't have to just rely on the city council. In my relationships with the New York State legislature, we can try to allocate funding up there just as well to achieve the same or supplement what we're trying to accomplish here. So yes, we have to work with the city council. Obviously, we're a city government, but we can go beyond that. We can talk to our federal representatives. We have some real good Congress people that were just elected. Richie Torres, I'm sure, would be interested in doing something like this. We have at the state level, the governor, we can speak to them, him or her, depending on what happens in the future. But certainly we have to make sure that we reach out to everyone who may have access to capital and funding to allow us to reach our goals.
Thank you. Mr. Cabrera?
Yeah, definitely. I would like to see the state come in stronger, because to be honest, it's just, we've been carrying the load in the city when it comes to discretionary funding through council member. The borough president, I think he has to have it. And by the way, we only lost the senior money last year because we had to balance the budget. We got cut short $2 billion from the state, and it was a dire situation. It should be restored this year, but it should be expanded, especially if he or she is the voice of the Bronx. And so many people approach the borough president with so many needs. I think it will be another layer to add to whatever the council members are doing in district, or they could couple together.
Thank you very much.
Let me just address something. He said that he wants the state to come in stronger. The state comes in very strong with funding. The problem is that when it gets to the city council and city government, it hits a dead end. And something that we allocate funding for, in my case, something 5 years ago has still not been released to the community. So it's not the state that's the problem. The problem is the city government, city council, and the mayor's office that they have it, and the city agencies that have an issue with releasing funding in real time.
If I could,
I'll have a quick response from the council member, then we'll let the assembly member weigh in. Go ahead.
And thank you, Senator. I feel the same frustration that you have, the log jam. But what I was referring is, like yourself, you don't get discretionary funding. I think every senator and assembly member should get what the council does, because the need is so great.
We do get discretionary funding. We just allocate it differently, but that's incorrect. We do get it. I'm going to get about
Let's move on. We'll move on from this fascinating discussion about the intricacies of discretionary funding. Assembly member Fernandez, do you want to weigh in on this?
Yes, but much to what everyone said, yeah, we don't really get discretionary funding. And that was something that this current governor took away from state legislative members. So hopefully that can come back again and we have actual money that is just given and not something that needs to be reimbursed by these organizations. And I think that partnerships are important. So federal, state, city level, we can get more out of a group effort. And that's something that, we will fight for.
Thank you so much. Eleanor, your turn.
Councilmember Gibson, your turn again, 90 seconds to respond. Let's say you have won the election and you are convening your first borough service cabinet, borough board meeting. Which agencies will you call to the table and what will your agenda action items be?
Thank you. That's a great question. Well, I hope I don't have a limit on the number of agencies because I definitely have DHS there, DYCD, ACS, DSS, DOT, NYPD. I would have everyone there because again, I think the first borough board meeting with all of our 12 community board, chairpersons, we need to really provide a lot of oversight. What is this new administration going to do? What are each of the agencies going to be responsible for as it relates to the administering of public goods and services for Bronx residents? So you know me, I aim high and I think it's really important. Social services is important. Public safety is important. Arts and culture and education, DOE, SCA. And so because I know these agencies through my time in the council and I know what each of them is responsible for, I think it would serve the best interest to invite as many as we can because there are our leaders that will want to understand what are we doing about all of these issues because everything works together. You can't talk about housing without talking about healthcare as well as public education. All of these things have to work together. So I would invite every city agency.
Thank you. Senator Sepulveda.
Thank you.
30 seconds.
One of the persons that I admire most in my life is Dr. Martin Luther King. And before he was assassinated, one of the things that he wanted to take on was a war on poverty. And that's because Dr. King realized that a lot of these social determinants that keep our communities, we get the worst healthcare systems, the worst schools, and the worst and the most segregated schools is poverty. So my first step will be to convene a group of think tank of highly skilled professionals, people, parents that live in the community, neighbors and so forth, to do one thing. And that is to establish the strongest economic development plan that you'll ever see from any borough president in the history of borough presidents. And that's going to be my plan. In order to have economic development, you have to have the following things. You have to have, first of all, a significant drop in crime. You have to have affordable housing, and you have to have much better educational scores. So my group will meet together. We're going to have specific offices to deal with economic development because from that, everything comes. If we can improve our economic development, if we can get more jobs, if we can get a system where we're not the highest county making less than $40,000 a year per family, we'll improve that. So my job will tell everybody, let's get this economy roving and going because that's how we eradicate a lot of the other problems that we have in this county.
Thank you. Councilmember Cabrera, the same question, 30 seconds.
Ellen, thank you so much, and I'll do it in 30 seconds. I will call SBS and hold them accountable. Why did we only get 1% of all the loans that were given during the pandemic, and require that they do better? HPD, let's get more affordable housing units on the queue, so they, whether it's in June or December when they are approved, we can see the Bronx listed there and many affordable house EDC to see what kind of new developments are we going to have that are going to produce jobs in the Bronx.
Thank you. And Assemblymember Fernandez, the same question, 30 seconds.
Thank you. Well, 2 out of 3 points of my campaign is bringing our small business economy back and helping our education system. Day one, I will look to working with SBS, DCA, the Bronx Economic Development Corporation, the Bronx Chamber of Commerce to put together a task force, a real team that can help small businesses get through the weeds of all these applications and bring together merchant associations to bring that strength to them so they can come back stronger. But also our education system. I'm going to call all the principals, all the community education councils to come to the the table and let us know what do our schools need so we can get them that funding, that resource, that help, that voice, that microphone right away.
Thank you all. Over to you, Jared.
Thank you very much, Eleanor. What do you see as the public health impacts of violent crime, including gun violence, domestic violence, and hate crimes, and the criminal justice system? And how would you address these issues as borough president? Mr. Cabrera, we'll start with you, 90 seconds.
Thank you so much. This is one of the topics that I have worked for many years. The impact, it destabilizes. Crime destabilizes a community. It just brings pain. It makes people feel very insecure. Look, I started the first mentoring program in our detention programs. Every kid that has gotten a mentor at our detention center, whether it's right here in the Bronx or in Brooklyn, as I was the chair of the Juvenile Justice Committee, we were able to implement this group and to come in, and not one of those youth have come back. What we're missing now is more youth mentors. As I mentioned before, the Cure Violence program that I think is just epic. I think that is the best Cure Violence program that I've seen in the nation. And my hat's off to those credible messengers that go out at 10 o'clock at night every evening to make a huge difference. And this year, they're in the city council, myself and Vanessa Gibson and others, we have pushed to making sure that the funding is double, and we have the assurance now from the mayor that that's going to take place. So we could provide these young people jobs, be able to be properly get them back educated. They have any legal programs. We're able to help them with those basic necessities and for the essential things that they need in order for them to succeed in life.
Thank you so much. Assemblymember Fernandez, you have 30 seconds.
Thank you. It is known that crime is rooted in poverty. So we need to bring those resources, that opportunity for job growth, job creation, community involvement. I too am a big supporter of violence intervention programs, having given some of the discretionary money that I get in the state for these programs. And this year in the state budget, we declared gun violence a public health issue. We got $10 million to continue to fund programs like this that are made by people of the community, worked by people of the community that know the community and can't stop the violence before it happens. And with the police, we need to create accountability and rebuild the trust, because trust is broken when those that do wrong, are not held accountable, whoever it may be. So accountability needs to be something we work towards on all levels, including in the police force.
Thank you very much. Councilmember Gibson, 30 seconds from you.
I agree. I think President Biden needs to declare gun violence as a national health crisis and pass comprehensive gun control legislation in this country because too many young people have access to guns. I agree, poverty is the root of all of these challenges we face, and we have to get to the root causes of why youth engage in violence in the first place. The trauma, the underemployment, the lack of opportunities in safe spaces and after school, and places where young people can recreate. I am proud that the City Council will push again for more summer youth slots, Compass, Sonic, Beacon, Cornerstone, Saturday Night Lights, after school, more mentors. We have to focus on the anti-gun violence movement. Over $50 million we spend investments to give young people a chance at a real success, and to really make sure we focus on families. We're getting ready for summer season, and we want to make sure young people have jobs. But we also have to look at all the other elements, the family support, dealing with intimate partner violence, domestic violence, dealing with so many opportunities that are not afforded to everyone, and provide real equity in the system so that everyone has a chance to be uplifted and given a chance at the pathway to a real middle class.
Thank you. And Senator Sepulveda, 30 seconds.
Oh, thank you so much. So as part of our effort in the New York State Senate, I'm going to be allocating $50,000 in the Bronx to any successful program when it comes to gun violence. Look, we have SNUG, we have other programs that are somewhat successful, buyback programs that are somewhat successful. But again, like most things in the Bronx, violence, criminal justice, or being immersed in the criminal justice system is a byproduct of poverty. If we're able to get people jobs, if we're able to get better educational systems, that'll take care of a lot of the violence that we have. But we also have to have a criminal justice system that is fair, that it's not based on the amount of money your parents have in a bank account or on the zip code that you come, because that's part of the problem that we have with our criminal justice system, that it depends on where you come from, how it was applied. And so we have to make sure that we continue the reforms that we've started with the criminal justice system. There's been a lot of fear mongering, especially when you talk about bail reform.
Thank you,
But
Senator.
you have to take care of a lot of these issues that we have with poverty, and you'll see how the crime rate will decrease significantly.
Thank you very much. Eleanor, to you.
Thank you. And to our panelists, this is the last question before our wrap up. Councilmember Cabrera, the Bronx has the highest number of shelters for homeless populations, many of them concentrated in the Northeast Bronx. This is not NIMBY, but the community has not been heard on the location of these shelters. As the city adheres to court mandates to serve a large and very needy population, how would you respond if the next mayor sought to locate more shelters in the Northeast Bronx or other parts of the Bronx?
Look, here's the challenge, Eleanor. The challenge is that the courts have said that the mayor has the discretion to place a shelter wherever DHS would choose. That's the challenge. Now, you have the public outcry. You have elected officials that could use their weight of influence to be able to say, and many of us here have said, we have carried their load. And you talk about the east, let's talk about the west of the Bronx as well. I have, Councilor Gibson could tell you, we both adjacent to each other. I have schools that 34% of them are living in shelters. It's time for the rest of the city to carry the load. I have students here from Staten Island. And so, and the only way we're going to be able to do this is to have the proper leadership at the mayor's office and to have a strong coalition of elected officials that we come here together and to be able to say enough is enough. Let somebody else turn at this point, and at the same time provide the care that our people who are in shelters here truly deserve, so we could have 5-star programs.
Thank you. Assemblymember Fernandez.
Fair share is really important. We should be taking care of Bronxites first. So if Bronxites are homeless, we should get them housing. Housing is a human right. But for the shelters that we have here, they need to be really reformed. They need to be cleaned up. I've heard horror stories of robberies, assaults, sanitation issues in these shelters. They need to be fixed up, cleaned up, but also with services, counselors, workforce development, guidance to help get back on your feet and into permanent housing. We need to make sure that our shelters are helping people get out of the shelters.
Thank you. Councilmember Gibson, the same question. You're muted. You're muted.
So sorry about that. I apologize. This has been a problem that's been plaguing our city for far too long. When you think about homelessness and you think about so many rent burdened tenants that are paying more than 30% of their income towards rent. Large majority of our shelter sightings are in communities of color. Let's be very honest, because we do not provide equity in the system. My district has been the dumping ground for many homeless shelters. I house my shelter families as well as others, and it's not acceptable. We need real affordable housing, but we also need to make sure that we stop paying these landlords and property owners millions of dollars to house homeless families. It's not acceptable. We have to look at real programs. We have to look at real solutions. We have to make sure that we have set-asides for formerly homeless families, and we really create opportunities where the city doesn't have to build new shelters. Why? Because we're building so much affordable housing that people have permanent housing. The final thing I'll say, the distinction that people living in homeless shelters are not working is not true. Many homeless families are full-time workers. They have a full-time job, but they can't afford the rent. And that is a problem. So we have to make rent really affordable.
Thank you. Okay. Senator Sepulveda, you have 30 seconds.
Thank you. What we have to keep in mind is that the reason we have more shelters in certain areas is because you have more homelessness. People that live in that community need shelter because they no longer can afford it. And the councilwoman is correct. actually the face of some of this diaspora are usually children. About 40% of those that are living in shelters are children. I have the highest number of children in homeless shelters going to school of any Senate district. And so what is the problem here? It's no big secret. We keep talking about all these fancy terms. It's really about poverty. If we can get families living wages, better jobs, and if we can get them working, then there's less of a need for a shelter, which I believe is a human right. And it breaks my heart when people, when they report to shelters, they're immediately equated with prostitution and drug use and all these terrible terms, when in fact, I see so many children there. So we have to really eradicate poverty, get people jobs, and then we don't need shelters. But also we have to restructure for affordable housing what the AMI is. It cannot be what the federal government says. It has to be within a jurisdictional difference area of the community where the shelter is being built. Let's take 20 blocks, a 20 block radius, and see what the average income is there. And that way you can cure many of the problems that you have with affordable housing. But first, economic development, eradicate poverty.
Thank you all for your thoughtful responses. Now we'll ask you to make a final 1-minute closing statement and address this question. How should we measure your progress toward increasing healthy equity in the Bronx during your borough presidency? What metrics or signals should we watch to see if you have delivered?
My first.
And we will begin with Assemblymember Fernandez.
Thank you. Well, let's look at where we're last in. We're last in a lot of areas. So we need to make sure that we're no longer last in homelessness or last in overall health. But we need to see how we can really deliver on these areas and put people in homes, make sure that our schools are well funded and really equal across the board with amenities. Make sure that our communities are representative of, make sure that our community boards are representative of their communities. These are institutions that have a lot of power, that have a lot of say, that can help influence and really make the community what it is. And we want to make sure that they're speaking for the entire community. So looking at how the community boards are, looking at where our schools are, looking at our healthcare institutions, that they are up to date, that they are well equipped and funded, is where I would say measure me.
Thank you. Councilmember Gibson.
Thank you. Great question. Thank you so much to City Limits as well as BCHN for all of your great work in hosting us tonight. I think we have to look at performance measurements around how we best address the health disparities, the high asthma rates, the obesity, heart disease, high blood pressure, diabetes. How are we able to turn those numbers around into success stories and not statistics? How are we able to create farming and urban agriculture and making sure that we invest in our families and we strengthen them and give them real opportunities? How are we able to create real sustainable and green jobs that provide stability and a pathway to the middle class? How are we able to provide real affordable housing for families, children, seniors, veterans, homeless youth, and LGBT youth? How are we able to create a mechanism where we have a real public education system that works for everyone, not just for some? All of these elements have to work together. You can't focus on one without the other. In order to address health disparities, you need stable, good housing,
Thank you.
good jobs, and you need to make sure that everyone has access to all the benefits they need.
Thanks. Thank you. And Senator Sepulveda, 30 seconds.
Thank you so much, because this is my favorite, one of my favorite topics. You see, from the very beginning of this campaign, I have a lot of confidence in my ability to deliver for this county. I have a concept known as a 15-minute city, where we can deliver all kinds of services to our community within a 15-minute radius for any person that lives here. But this is what I've told my colleagues, and I've challenged them on this, and no one has taken me up on the challenge. And I suspect it's because maybe they're not as confident in their ability to reach their metrics as I am. I've said, if by the end of my first term, we are no longer last in healthcare metrics, no longer last in employment, and we do not have a graduation rate that exceeds 80%, then I won't run for re-election. No one has taken me up on that challenge, and I suspect it's because they don't feel as confident as I do. Once I win, if I don't reach those metrics, I will not run for re-election.
Thank you. And Councilmember Cabrera, we started with you and we're ending with you. Same question, 30 seconds.
Thank you. Look, at the end of the day, how do we measure success? Because that was the real question here, is to be able to have access and results that are equitable. Unless we don't have that, we have not achieved success. So what does that mean? That means that we can't continue to have a broken system where 4 times as many Latino are hospitalized than whites. That just shows that the results at the end of the day is speaking of a broken system. Let's get back to providing healthy nutrition classes. That's measurable. We can measure that. We can measure how many students are getting trained. We could measure how many faith-based organizations we're partnering because they have the trust of the community. We could measure quality training for our home care workers. We could measure to be able to say, this is how much funding it's going to require for our healthcare institutions to be able to be fully equipped so they could be customized. They could have the customized tools necessary to achieve the goals that they have, to be able to have true representation of people that look like us and represent our community at the highest level all the way down. I will count that as success.
Thank you. Thank you all again for your responses, for your enthusiasm and your commitment to the Bronx. Jared?
And thank you so much, Eleanor, for being co-moderator. Thanks again to our candidates and their campaigns, and to the BCHN and City Limits team members who made tonight possible: Akila, Megan, Paulette, Raquel, Renee, and Roger. The complete video of tonight's event will be available on the City Limits and BCHN websites shortly. Remember, the primary is June 22nd. Early voting begins June 12th. For more information on how, where, and when to vote in the primary, please visit vote.nyc. Be sure to tune in at 7 p.m. tonight, that's in about 10 minutes, for the first official Democratic mayoral debate on New York One, New York One Noticias, NYC Gov TV, NewYork1.com, or WNYC 93.9 FM or 820 AM radio. Have a good evening, stay healthy, and please don't forget to vote.
Thank you, Jared. Thank you, Eleanor.
Amen. Thanks, everyone. Thank you, Jared.
Thank you
Thanks,
all.
Eleanor. God bless
welcome.
everyone.
Well, stay healthy.
Bye. Okay.